What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have a very special guest. She's literally one of my favorites, someone I definitely look up to. So I have Dr. Halim on the podcast today. So Doctor, I'm going to give a little, I'm going to be the hype person for just a second here, and then we're going to start picking her brain because that's what I got her for. So Dr. Halim is a board-certified anesthesiologist who has also done fellowship training in critical care, trauma, pediatrics, pain management, as well as aesthetic, regenerative, and functional medicine. So basically, she's brilliant, and she's done like every training certification, and I'm just so honored I get to interview her. She has done her medical training through Northwestern University in Chicago. She also did a research fellowship in pharmacokinetics, pharmacodynamics prior to her internship in internal medicine, followed by a residency and then fellowship at Northwestern University in Chicago. So she loves to learn and loves being like a professional student, which is true. I am very drawn to Dr. Halim for a couple reasons she's got so many expertise, but really I feel like not many of us can marry functional medicine and aesthetics and like kind of flip back and forth and see how we can layer many of these modalities together. Like I feel like, and I see her nodding, I feel like many times you're either good at aesthetics and you like might try to dabble in it, or you're good at functional medicine and then you look haggard. And so I feel like you got to look the part. I feel like you got to talk the talk. And I feel like Dr. Halim 1000% does that. So she has some special training in advanced laser techniques, PDO threads, skincare, hormone, nutrition. Really, I kind of started following her and really just being inspired by her through the work she was doing or is doing with SSRP, so Seed Scientific Research and Performance. She also has some expertise in facial rejuvenation. She's also has a background in training, academia, all those things. And so I know she's an active participant of A4M, SSRP, Boston BioLife, and several other companies that I know she works with. And what I really love about Dr. Halim is that she's always going to give you a very honest opinion. And so in a very good way, in that she's not going to steer you wrong. And so these are all things that many of us providers should aspire to be like. So all right. Now that I've like really just set the tone for this amazing podcast, they're like, who is this? And how do I get a hold of her? Okay, Dr. Halim, first, let's start off with how did you get into the functional medicine space going from anesthesia?
So that's a good question. Thank you, Lexi, so much for the intro. And I truly love all your podcasts, and I love all the work that you're doing, especially trying to help teach people, educate people, because I think in our space, whether it's functional, whether it's aesthetics, whether the regenerative space, I think this is an ongoing learning process for all of us. And that is very true. That's why we are professional students. And I tell people this all the time because I do a lot of trainings, I do a lot of consulting. So the big thing for me is that you don't roll out of bed one day and become an expert. And this is why I have an issue with people that just take these little short trainings and all of a sudden they're an expert in a field or an expert in even treatments, right? And this is where we run into complications, and it gives our actual space and industry a bad reputation. That being said, yes, I started in anesthesia critical care trauma, which I loved. I loved the adrenaline surge and rush. And yes, I did research and all of that. I actually, and people think that I started in aesthetics before functional. It's very interesting because with my background in anesthesia in pharmacokinetics, pharmacodynamics, the easy transition was actually functional medicine, especially because of the fact from the regenerative standpoint, the pharmacology standpoint, the bioscience standpoint, it was like a no-brainer for me. And also because when you do anesthesia critical care trauma, which most people don't know much about the world of anesthesia, they think that as an anesthesiologist, put people to sleep and wake them up. So this is the reason I ventured into the world of critical care trauma, which was also ICU, and it was more acute. Problem is that a lot of our acute care models are very outdated. And this is when I started seeing, having worked in trauma and working in the ICUs and everything, and I ran the ICUs for a while. And I also was national director for a publicly traded company doing hospital startups around the country as well. So
hey, just add it to the list. Sorry, I missed that one.
So I have had like a bird's eye view of different aspects of our healthcare system. And that being said, none of us have all the answers. And this is what I tell everybody. I don't care whether you're primary care, whether you're a surgeon, whether you're a plastic surgeon, whatever specialty, dermatology, whatever. So at the end of the day, the big thing for me was that when I was seeing patients being sick and not recovering, or people that went from acute to chronic, we were always missing something, a piece of that puzzle. this is when I started delving into more of the research. And that's why I also got involved with A4M, just because of the fact that we needed to become more progressive as to how are we diagnosing patients. And one of the big focuses that I've had is assessment, treatment, prevention. And that's why I always tell everybody you need to be proactive, you need to actually be more predictive, and you need to create personalized, customized treatment plans, because none of us are identical. And this is where the functional medicine comes in, because you and I are all trained to order basic chemistries, basic CBC. That doesn't draw or paint the whole picture of what's going on internally. And I think this is where we were missing a lot of the underlying causes of disease, which we have learned over the years and has become proven more and more, whether it's academics, whether it's functional, whether whatever specialty you want to call it, is that inflammation is the source of all evils. And the underlying inflammatory process that undergoes in our systems and our body creates a lot of damage over time and sets us up for cancer, for heart disease, diabetes, you name it. Now, take all of that and integrate it into the world of aesthetics, because what people never actually looked at up until now, which you hear about it in all the national conferences, because I do speak at a lot of the national and international conferences, is that gut microbiome, skin microbiome, gut neuroaxis. So we all know all three are very interrelated. One affects the other: cognition, your skin, your vitality, you name it. So you can't piecemeal it. And this is the reason that I have spent years of my career and time putting together all these pieces. So when my patient comes in, I start with beauty and health from the inside out. And I tell my patients that. I have patients that come in that they just want to do a laser, and that's easy for me to do, right? I've been trained by the best in the industry, and I'm very grateful for having been mentored by some of the best in the industry, in functional, in plastics, in aesthetics, in dermatology, you name it. But so it's very easy fix. But first thing I tell them is, well, let's take a look at what's going on with your skin. Let's get some labs. Let's take a look at what your skincare regimen is. What is your diet? What is your nutrition? Do you have a sedentary lifestyle? Because one of the other things, which not too long ago, we did a conference in Fort Lauderdale, and my topic was epigenetics and regenerative medicine. And we need to look more at epigenetics, because yes, there is a genetic component, but as we've realized, it's only 10% of the picture. The rest is definitely epigenetics. And this is where the integrative part of functional medicine comes in. And I think it's been overlooked for so long. And now people are trying to jump on the bandwagon. But the key to this, which is a big pet peeve for me, is that you can't learn functional medicine in a day or a weekend or a week. And I love the fact that there's more conferences that are more integrative. And just as you mentioned earlier with Dr. Seeds, and SSRP brings all the great minds together. There's many great specialized conferences that I think are very important for a lot of the practitioners that want to get into this field, that want to help their patients actually feel better and look better.
Right. No, I completely agree. And I think what we learn too is just when you think you've got something mastered, you're going to get a patient and then they're like, well, that didn't turn out the way that I thought it would, and I feel like that's why going to conferences and continuing education is absolutely key for many of us practitioners, because we all got to learn from each other, right?
And this is the reason that I have a very open door policy, even though sometimes it gets a little overwhelming with all my travels, all my practices, because I do have 4 office locations and all my travels. But the thing is that whenever I have a colleague that reaches out and says, oh, I'm stumped because I have this or this other patient, I am so happy to share with them tips and pros. Now, mind you, and I kudos to those people, because I know for me, if it's something that I don't know, I'm going to refer them out. And I have had many people refer out patients to me because of the fact that they felt either not comfortable enough treating the situation, underlying disease, or the aesthetic problem at hand, or they're stumped. And this is where, as a professional, we need to know where, as I say, stay in your lane, but know your boundaries, skills, expertise. Because at the end of the day, it's not about just charging a patient and just having a client. It's all about optimizing the patient, because I know if it was me or my family member, I would want to get the best possible care and treatment, not be brushed off or be just like, oh, okay, here, let's just try this and see if it works. And thank you for your credit card.
Right. No, yeah, absolutely. I can't agree with you more. So let's talk about, so anesthesia, when did you really start getting into the aesthetic piece of it?
So that's a great question because people ask me that all the time. And it was so funny. So being an anesthesiologist, being in the OR with every specialist, like whether it's neurosurge, craniofacial malformations, plastic surge, you name it. And it was funny because I'd be in those cases and in the trauma. And then some of the plastic surgeons I was working with, they were like, why aren't you doing aesthetics? I mean, you have a better eye for this than we do, just because, I'd be in the OR and I'd be like, okay, that's not perfect. And I am very type A personality. And it was kind of funny because at the time when they said that to me, I was just like, I don't know if I could do Botox filler. I mean, that's not very brain stimulating for me, right? And they laughed. And I said, you guys are surgeons. Sure, everybody's got their expertise and all that. And yes, I do have a background in art and painting and sculpting. Okay. So yes, I had that eye. So it really didn't click in my mind to just do aesthetics. And this is where I was already researching and doing stuff functional to integrate it with how I was managing my patients in critical ICU care or in medicine or any of my patients in general for post-op.
Right.
And also even colleagues and so forth. So that's where I started the functional medicine aspect first. And then over time, I was just like, you know what? Patients are asking about how they can also look and feel better. So then I can add the aesthetic component. And this is the why a lot of people started aesthetics first and now are trying to bring in the functional component. And I actually started backwards.
So did I. I was functional first, started at a bariatric surgeon's office, ran a medical weight loss program, got him feeling better on the inside, got functional medicine training through IFM. Oh, now I got to add aesthetics. So yeah. I think if we start out in functional, what's so cool, and I don't know if it was the same for you, but because we were helping patients from the inside, we built this trust with them. Yeah. And so it almost like took the stress a little bit away of, I'm not competing with the injector down the street. Listen, we're vested here. Like I'm managing your hormones and I'm looking at your gut. My patients, when I say, you haven't steered me wrong yet, like, let's go ahead, shoot it up. And I'm like, oh, okay, well, let's focus here. So, no, I agree. Coming from the functional side into aesthetics is great. It's awesome. It's so good.
I think all of us have gotten into functional for either a personal reason, whether it's a family or friend member that had something going on that wasn't able to get treated properly, or even yourself or myself. We've all been down that road where we get our blood work back and it doesn't paint the whole picture. And then your primary care physician or the ER physician is like, oh, well, I don't know what it is, or yes, this is what it is. And here's the medication prescription. To me, that wasn't enough satisfaction and it didn't answer everything. And I think that's what made me more curious and more focused on that. Yeah. Like I wish we had a magic wand to cure everybody and to fix everybody's problems. And maybe one day in the future with all this stuff that we're talking about, the regenerative medicine, I'm hoping we will be able to see that in our lifetime.
Yeah. No, I completely agree. So you were anesthesia, functional, turned at the roundabout, went into aesthetics. So let's talk about, so really my goal here is I want to dig into the regenerative side of stem cells and exosomes. And I heard you speak at SSRP and I sat in that audience and I'm like, wow, there's like a whole layer of medicine that I don't think that people really understand it. And I mean, there's a lot of layers of medicine people don't really understand. But I think what was very eye-opening to me is because, I also go to aesthetic conferences and I speak at some of them. And when I'm hearing some of these people talk, I'm like, y'all don't really know what you're talking about, in the sense that like I don't know. There's a lot. And that's what my goal really is, to try to dig into some of this with you. So let's talk first a little bit about, give me some examples of your experiences of kind of when you started getting to stem cells and exosomes. Like, what was the why behind that?
So stem cells came first before exosomes in my experience, just because of the fact that, given the fact that with pain management and regenerative medicine, as you know, and also orthopedics. So, back in the day, stem cells were not approved to be used for orthopedics unless it was bone marrow. Okay. And then there was always a big push to use adipose, but adipose was only actually approved for cosmetic plastic surgery. Now we are able to do either bone marrow or adipose, because as long as it's autologous, and that was a whole big push for a long time with the whole FDA.
Right.
So this is where I originally, and I thought stem cells were very cool, very interesting. And I'm like, wow. And this is where I've also done a lot of research, which I know is not FDA approved. And I always tell everybody, you have to stay within FDA guidelines, because even though there's other countries doing other things, there's other people outside of this country doing things, and we've seen great literature and great results from them, but you have to stay within FDA guidelines and rules in order to maintain practice, right?
Right.
So I've read and seen, and I stay up on that literature, especially when it comes to embryonic stem cells, which is something that we cannot use here in the United States yet. And I'm hoping one day we will be able to, because there is so much promise in that field and in that world as far as treating different underlying disease entities and maybe possibly even some cancers. Okay.
Yeah.
So stem cell became something very fascinating to me. But then also over time, you heard like this whole big thing about exosomes. And it wasn't until basically, people were like all about the whole buzzword. And also, for transparency purposes, I am the chief medical officer for Chimera Labs, which is a exosome research facility and manufacturer. And with Duncan Ross, who basically is the PhD founder CEO, it was very interesting with a lot of the conversations that I had with him and learned a lot from him. I also learned from so many other different companies, because I'm the kind of person, I tell this to everyone on stage, even when I'm on podium. I may be the chief medical officer for Chimera, but does not mean that I am tunnel visioned and I refuse to listen or hear or see or even try the different products that are out there, because there are so many products. But even when we were at IMCAS this past year in Paris, okay, and there was a conversation comparing exosomes and companies, the biggest and most important point that was brought up at that, and I think it needs to be emphasized, is that the word exosome is a buzzword. People don't even understand what it is. And it is an extracellular vesicle that carries cargo information as a cell-to-cell communicator, okay? Now, what does that mean? Because everyone and anyone's calling everything an exosome nowadays, right? They say, oh, well, this is an exosome because it has this information, it has this, or it has growth factors, or so that means you can call PRP an exosome, right?
Yeah.
Or you could call stem cells an exosome. But if you also look at the definition, the true definition is exosomes are the progenitor of stem cells, right? But also at the same time, basically they are communicators. So at the end of the day, what's your source of stem cells? Where are they coming from versus what's your source of exosomes? Like we said, stem cells have to be autologous, adipose, bone marrow. Well, we know that the exosomes, right? Can you derive exosomes from yourself, the autologous? Yes, but at the end of the day, now there's a lot of literature coming out, even with stem cells, saying that instead of autologous, right, allogeneic is more worthwhile and more beneficial. Well, with exosomes, like for the Chimera ones, they are derived from placenta. Okay. So we know that those are clean, and the process of how they're made and manufactured basically just shows you the process. It shows you what's in it. And this is what the definition, even when you mentioned earlier, people talk about trillions and billions and this and that. And, it's not all about that. It's actually, what is your content of mRNA that's in there? What is the content? It's not about vesicles, because at the end of the day, and this was something that I learned from Duncan Ross, was the fact that, when he said to me, you could put water under a microscope and count those as particles, right? That's a misnomer, misinformation. So like I said, we all are always learning from each other, and you got to give credit where credit is due. So also there's plant exosomes, which people ask, well, are plant the same? Can they communicate? In the derm world, people are more hesitant to use human-based or human-derived exosomes, and they're saying that the plant-based are equally as effective. So what I look at too, and I've said this to a lot of people in the world of aesthetics, I have nothing against plant-based, and I spoke at a derm conference about this. My concern, though, even from an aesthetic standpoint for patients that have sensitivity and allergies to botanicals, right? Even botanical-based skincare, that's going to be an issue. Okay. So you have to take all those factors into consideration. The other thing is that there's other products on the market that are stem cell conditioned media that call themselves exosome. But this is where you have to differentiate. Is it truly an exosome? Is it stem cell conditioned media? Also, what is the viability of the exosomes that are there? Because just like a simple example, vitamin C for the skin. We know that L-ascorbic acid, when it sits on the shelf, it actually degrades. So when you're putting that cream on your face, you're not getting true vitamin C unless it's encapsulated and made in a form to be absorbed. Just like when we do bioidentical hormones, there's a million compounding pharmacies, right? Why is it that if you look at someone's labs and they've been on hormones and their labs haven't changed? Because the transdermal carrier is not there or is not working, okay? Everybody can lather their skin with all kinds of creams, but unless it's breaking through and getting in and getting absorbed, it's not going anywhere. Okay. And I can continue to talk about this for hours, right? So this is what I compare it to. So this is the reason when I tell patients and even colleagues when I'm training them, what are your goals? What is the end goal that you're trying to achieve? Now, one of the great things I also have done is some of the trials with like hair trials and so forth, using exosomes and comparing. Because yes, peptides are fantastic. And yes, the GHKCU for hair growth, right? But then again, a lot of people are also adding and combining with it topical minoxidil or the Rogaine or other like finasteride and all that. And I always tell patients, you can't just go with a topical one size fits all, because do you need a DHT blocker or not? You may not. Not everybody does.
Right. No, correct.
And I need to like know if they need it or not, because what's the point of putting somebody on a DHT blocker when they don't need it versus somebody who does need it? So this is the way also for exosomes when I started for non-surgical hair restoration. And this is something to bring us up to, I know I'm fast forwarding a little, is that for all the years that I've been in aesthetics, everyone's been doing PRP for hair loss, right? But also one of the big things that I always was debating and arguing, because I'm always the devil's advocate, said, okay, if I'm the patient and we have seen and heard from multiple providers, when you ask them, well, how many sessions of PRP does a patient need to see results for hair? And everyone will tell you, 6 to 10. So my devil advocate question is like, if I was the patient, I would not be compliant, because who has time to come back every month for 6 to 10 sessions? And for whatever they're spending, there are other ways to do it besides, of course, hair transplant or FUEs, FTEs. So that's when I started delving and doing those different comparatives and said, okay, well, if we have exosomes and it's a cell-to-cell communicator, and we have PRFM, which now is also another big thing in the last few years, right? Because PRFM actually allows the release of the growth factors over a prolonged 2-week period, as opposed to the PRP, which is immediate release, okay? So I said, all right, what if there is a way for us to actually stimulate the dormant hair follicles, right? But you also have to do a proper trichoscopy assessment, hair scalp assessment, which I do, an imaging assessment, in order to make sure, as I tell everyone for hair, for example, I can revive your dormant follicles. But if you have 0 follicles or they're in the morgue, I can't revive them. So the dormant may be in the ICU that I can revive, but the ones that are gone, they're not coming back. You need a hair transplant, right? And that's where honesty comes in. Now, when I started using the exosomes in conjunction with PRFM, I got fantastic results in 4 weeks, which you don't see with PRP in the first session. And when I always tell patients and other colleagues this, and people say, oh, that's not possible, it's the visual. I go, yeah, you know what? I agree. Sometimes photography is not the full picture. This is where I am able to actually show the thickness of the strand, the scalp quality, the density of the hair, and it also graphs out for you what percentage of hair growth you have gotten in the last 30 days, 60 days, whatever.
And how are you testing that?
So I have an imaging system that I use, right? And just like also even for the skin quality, even for skin density, even for skin hydration. And this is the other thing too, you'd still have to assess all of that. Just like when you also, because we do offer hair transplant in all my offices, right? And we do have the machines. But at the end of the day, not everybody wants to invest in that. Nobody wants to go through that process. So I always have to tell them, you're a candidate or not a candidate. And I'm able to get them their endpoint results in 3 to 4 sessions, which is beats 10, beats 6. Amazing.
Yeah.
You know, because I always tell my patients too, I guarantee my work. And I know that's a hard thing to say, because my number one goal is patient satisfaction. It's not about making $1.
Yeah. No, that's amazing. That's so good. So there's just a lot to unpack. I'm just trying to like mentally go back a little bit. So one thing that I think, we as functional medicine people kind of always put to the forefront of our mind is when we talk about PRP and PRF. So PRP is platelet-rich plasma. If you're a patient and you're listening, PRF is platelet-rich fibrin. So just as Dr. Halim had said, PRP is kind of a rapid release of growth factor versus PRF is kind of like a slow release. But here's what I always tell patients. That blood is only going to be as good and as healthy as you. Right? So just as Dr. Halim had said, do you need to be on a DHT blocker? So like in my mind, I'm visualizing, this 50-year-old guy, overweight, big belly, on statins, on some erectile medicine. So we know he's got some, endothelial cardiac dysfunction, right? And I'm thinking, hell no, I don't want to put PRP in that head, because it's only going to be as good as him, right? Versus our younger gentlemen, maybe in their 20s, healthy workout. That is by far better candidate for a PRP treatment versus the 50-year-old who probably, has some low testosterone, probably some inflammation going on, like many of those other things, right? So I think just as Dr. Halim said, like, you need to look at the inside and kind of work our way out. And that's where I think having that functional medicine background, just as she said, I'm not here. It's not just like, give me your credit card and like, let's move on. It's like, whoa. Let's take a step back. Are you a good candidate, first of all? And if you're not, then we start bringing out all these extra really cool tools that we have in this toolbox. And so to her point is the right candidate for the right procedure to get the right outcome, right?
Absolutely. And I think you made an excellent point, Lexi, because just like as you said, the age and underlying health, because this is another factor that comes even from a regenerative ortho standpoint for joints. And even if we do bone marrow or adipose and you take someone's stem cells and someone who's over a certain age, and it's been shown and proven that over the age of 65, your stem cells are not as functional anymore, right? This is the reason now the whole big push in the emerging is to bank your stem cells at an earlier age before the age of 65, right? So at the end of the day, those patients that are coming in who need total knee replacements but can't have it and instead want to opt for a stem cell, right, for ortho. The question is now, how viable are their stem cells? And this is the reason a lot of people are going outside of the country for the allogeneic to get the embryonic stem cells and joint injections, right? And for other indications. So same thing with the PRP, just like you said. And you're absolutely right. I actually did have a young, healthy female male, excuse me, not female. He had an amazing level of testosterone because I always do labs before I do any treatments on patients. And he was not on testosterone. This was his natural, right? I did one session of PRP on him and boom, his full head of hair thickened and was fantastic. Now that is not typical with
I was like, that's super atypical. Those are unicorns. Let's just be honest here. Those are unicorns in our practice.
Right. And then we don't really see that often. I was blown away and I was just like, whoa, because it was so funny. He was blown away. He was the one who was ecstatic because I treated him in my Chicago location, right? So he sent me the pictures and follow up because I like to maintain with my clients like wherever I go. And I was just like, is this real? Is this really you? Is this your head of hair? And he had somebody do all the different angles like we did in the office. And I said, okay, I'm impressed. You don't need any more treatments. But that is a unicorn. That is not typical results. Okay. And this is the reason also even a 30-year-old that's maybe healthy, not healthy, has cholesterol, has a lot of environmental damage, mitochondrial dysfunction, as you mentioned, those are not going to get the same results. And that's why we have to fix the inside first.
Yep. 1000%. So you had brought up something really interesting. You had said you do a bit of a workup kind of, prior to treating them. Out of curiosity, what does that look like? I know, we draw like a battery of tests kind of thing. I'd be just curious to know kind of like, what are the things that you're looking for exactly?
So I created my own panel, right?
Yeah.
And it's so funny because I know when people say to me, oh, well, what panel did you draw? And I'm like, well, I don't like to share it to the general public. I will share it with colleagues.
No, that's totally fine.
Obviously, I don't want people just because there's sometimes, here's the thing. If you stick to a panel that I get from you or you get from me, and we're so focused on that, we may miss other stuff. So this is why I say you have to do a proper history and physical on the patient. You have to speak to your patient because this way you may add or delete certain labs. That's what I was going to get at
because when I train and, physicians come shadow me like, well, what's your panel? And I'm like, well, is this a female who has heavy menstrual cycles? Because iron and ferritin, those are going to be like looking at, is this patient maybe post-viral infection? Maybe I would be looking at zinc levels. Is this that 50-year-old guy? Because I need to be looking at DHT, sex hormone binding globulin, 5-alpha reductase, looking at their lipids, looking at their CRPs. Like it depends. And so that was the point of my well, what's on your panel? Only because I knew what the answer was, is that you're going to take it to an individual premise because everyone is an individual. And so you can't cookie cutter many of these things. I get asked all the time, like, oh, can I see your protocol? I'm like, well, here's kind of the framework, but it's not a one size fits all because it totally depends on the patient.
Absolutely. And the one thing, though, that I have to admit, I think everybody can benefit from is always checking the CRP and homocysteine levels, because there are certain baseline inflammatory markers that I think we all need. And
Right.
even when I've checked my own, depending on what's going on in my life and my travel and work and stressors, you'll see it'll go like this, right?
Yeah.
And we want to try to get that nice balance, because we want to also make sure there's no adrenal dysfunction, adrenal fatigue, which comes along with all of that cortisol spiking, right? And that can also affect hormones, just like diet
Absolutely.
affects hormones.
Oh,
This is
1000%.
something, everybody's so big right now on weight loss, weight loss, weight loss. And I remember for a while when everybody was on like HCG, but here's my thing. There's nothing wrong with weight loss. And I think these GLP ones, I think they're fantastic. They've been around forever. And I think a lot of people are taking it out of context. And when everybody's now, when it first came out about, the Ozempic face, the Ozempic butt, the Ozempic this. But I'm like, okay, any weight loss process that is rapid and extreme, you are going to get saggy skin. Okay. So at the end of the day, that may be fantastic for the plastic surgery world, that everybody now needs surgery. Okay. It's a great booster for that economy. But at the end of the day, that's not the cause. And this is why I tell people we need to find the cause to actually treat the proper effect, right? Not put a Band-Aid on it. Okay. You need to treat the underlying cause. So this is the reason that I say to everybody, panels of inflammation, yes, are key for all of us. Okay. Even like high glucose, that's something that should be controlled in everybody. I don't care what age you are, because in glucose sugars, we know with glycolation per skin, that's very aging, right? For your organs, that's very aging and detrimental. Fatty liver, it's not just from alcohol. People think, they get fatty liver from alcohol. No, that's not necessarily true. And this is where you need to understand underlying disease processes, right? Because if you don't, then you're not sure what you're looking at and what panels to order. Just like you mentioned with women's menstrual cycles. Also, do they have PCOS? Are we working up the proper labs? A lot of times Hashimoto's is underdiagnosed, right? It's missed because we're not diagnosing subclinical.
Yeah.
We're waiting until they're full-blown hypothyroid and looking at the basic TSH, which does not paint the proper picture.
Yeah. No, 1000%. So we talked a little bit about PRP, PRF. Let's talk now about what exactly do they do from a hair perspective, a skin perspective. What is it that exosomes do in the body? You mentioned they carry mRNA. So what is that?
So they have nucleic acids, obviously, they're proteins, they have the mRNA. Now, as a cell-to-cell signal and communicator, what it does, it also that we have seen is that it actually allows to prolong the anagen phase, which is the growth cycle of the hair. Now, we know that PRP does release growth factors. And also, here's the big debate that's been now a new discussion of the topic. We know PRP is inflammatory, right? And we know that basically, what are exosomes? Exosomes do what? They bring down inflammation. Okay. So now you have the balance of the two. This is the reason too, the big debate now also, remember when they used to say with PRP, you have to have a certain number or count to grow hair. But the problem was when they said it was a 3 multiple, a 5 multiple, 7 multiple, 9 multiple, and it used to be the higher, the better. Now they're coming back and saying, no, too much. If it's too high, even if you go to the 9 multiple, the inflammatory process actually may affect the hair follicles. So this is the reason when, depending on the PRP kits and machines I use, I always go for the 5 to 7 multiple on my PRP. When it comes to face and skin, you can get away with a 3 to 4 multiple, and that's what I tell people. Okay, you don't need to really be that high of it. But at the end of the day, when I'm also using the exosomes, it is not only delivering the proper nutrients, okay, and it's also helping with the inflammatory process for the follicles so the follicles do not get knocked out, and it's prolonging the anagen phase, and it's giving all those nutrients in conjunction with the PRP. Now, people will ask me, do I need to do PRP or PRFM along with it? And I say it's plus or minus, and also mind you that we're going to just emphasize here that people will ask, can you inject it? Well, once again, I'm going to repeat, according to the FDA, exosomes can only be used topically because as we know, the FDA is still, nothing has been FDA approved in the world of the exosome industry, and trials are undergoing still. And until those come out, just like with PRP, for the longest time, PRP was also not FDA approved. And then it became accepted. And even injecting it for hair is still considered off-label. But nothing is off-label until it's FDA approved. Because that's what people say, well, can I use that as an off-label with exosome? I'm like, what came first, the chicken or the egg? You have to get FDA approval first before you can claim something is off-label, right?
Right.
Just like how we use neurotoxins or dermal fillers. They're FDA approved for a different indication, a specific one, a specific area in the face.
Yeah.
We as practitioners use it in other areas of the face with different techniques. That's off label.
Right. Yeah. Like Sculptra, we use a lot of Sculptra in our practice, off label.
Right.
So that's super, super helpful. Where do you feel like, because now I feel like, with the pandemic happening, a lot of people are doing work virtually, right? So they're looking at their face way more often. And what I have found is the rise in my practice of Sculptra. A lot of people want natural biostimulation. Where do you feel like you see this going into like the regenerative aesthetics? Like, do you feel like this is going to be replacing something, or do you feel like this is going to be like another tool in the toolbox kind of thing?
That's a great question, because also another thing that comes up is the biostimulators for skin. So Sculptra, as we know, stimulates actually type 1 collagen. Just like now, the big thing is hyperdilute radius, which I love. And hyperdilute radius, the beauty of it is actually stimulates type 1 and 3 and elastin, which Sculptra does not do. Okay. Just because of the composition. One is PLLA, the other one is the calcium hydroxyapatite mixed with the sugar carrier. That being said, I do not foresee stem cells or exosomes replacing fillers, right? I think they can be additive and helpful and boosting, because it's more regenerative to regenerate and heal tissue. Okay. Reverse the aging process by regenerating that tissue at the different layers of the skin. So that being said, just like with biostimulators that we're using to stimulate hydration, to help with elasticity in the skin, I think the aesthetic toolbox, you can bring and tie all that in together. One is not going to replace the other. Like I tell patients when they come in, when they say, should I get Botox, should I get filler? And I'm like, that's like apples and oranges.
Yeah.
Neurotoxins do not replace dermal fillers, and vice versa. So it depends what your goal is. Same thing like, for regenerative medicine for joints. You're not going to put Sculptra or radius in the joints. So you're going to be looking for something that is going to be autologous for now, or allogeneic, as we said. So this is where, do I see exosome stem cells replacing any of the aesthetic fillers? No. I see it help boosting it, improving the results, the longevity.
Right. Yeah. Yeah, I agree. I think that just adding it to a different kind of like to help like make them work better, basically. Like they can make and enhance some of your laser, your recovery time, your microneedling, improving that cell turnover, increasing things like VEGF and collagen production and reducing inflammation. And those are a lot of the benefits of them. And so it's kind of like we're making all these processes just kind of like work a little bit better. And that's how I describe it to patients for that. So if a practitioner is interested in incorporating into their aesthetic practice, is there because there's so many, and that's why as soon as I was like, she agreed. Okay, what do I get to talk to her about? Because there's literally so much. But I feel like you're such a great expert, and you explain it so well for practitioners to kind of like digest, because it's a lot. It's like drinking from a fire hose with some of this information. And so, where do you feel like? And just as you said, you are a chief medical officer, and so is there like a course? Is there like get with the rep and like start talking with them? Is there like, I would learn, like when I'm training on fillers, I would say, start with 3 fillers. You got your high G prime, you got your expression tech, like get really comfortable with that, then add in the next one, then get really comfortable with that, then add in the next one. Like what would you say, like a piece of advice for practitioners who want to learn more about it?
So the thing is that unfortunately right now, with the space being such the wild, wild west, as they say, getting with the reps, I mean, no offense to reps, because some reps are my friends, right?
Yeah.
But the thing is that every rep is going to only represent their line, because that's their job, and they have to, right? In all fairness, until they move to the next company, right?
Right.
We see that with lasers, we see that with skincare products. So that's the way of the world. So that being said, basically, I think people need to do their research, their homework. I always tell patients this, and I tell also a lot of my colleagues and people that I do train, because when people say to me, oh, you only use Chimera. And I say, well, I've tried other products, just like, I may like one particular skincare line that I'm biased toward, but I do also use others. Okay. And I do represent and have done editorials on many skincare lines, right? The thing is that I think the proof is in the pudding. And I've said that to a lot of my colleagues. It's not going to hurt you. You can buy one of each You can
Yeah.
trial and test it, see what the results are. You will be the judge, right?
Right.
You can go by my word or you can go by your personal experience. That's number one. And I think that also allows me to preserve my credibility, okay,
Sure.
in the industry, because I don't want to come off as being biased in any part of this industry, whether
Sure.
it's exosomes, devices, lasers, even fillers, right? And I use every possible filler on the market, okay? And I do have my favorites, of course, and the reps know that. That's number one. Number two, what is their end goal? What are they using it for? And they have to be aware of the fact too, is the product sterile? Is it not sterile? Because don't forget, when you do a laser or there's an open wound or something and you apply something topically, you do not want to be putting something on top of the skin that's going to irritate it or infect it. Okay.
Right.
This is the reason even some skin moisturizers and some occlusives that we use post-aggressive laser, you have to be careful of how clean the skin is so that they don't get a bacterial infection or biofilm or anything like that. Right. So that's number one. Number two, I always tell people to speak with other colleagues. Don't go just by my word. I mean, I always tell them, listen, if you have questions, feel free to reach out to me. I'm happy to explain it more in depth to you. Also, I'm happy to show you the literature and the comparative. And I know that's the thing that we even at Chimera, for transparency purposes, have said, hey, listen, we've said, we're happy to even have you come to the lab and we'll compare the different products, and we have already done that to see what each product has and contains and why not. And also, there are some products that are exosome that are home care, which is like an exosome-based cream for skincare, Now, does that work? Does that not work? Listen, at the end of the day, this is something that I always say, any product that you use for home care is not going to penetrate beyond the stratum corneum, right? It's like the reason when you get a facial and you exfoliate because you abrade a top layer. But if you're going to use a product at home, I'm sure whether it has some form of exosome or stem cell conditioned media, it's going to have some vitamin C, some anti-inflammatory, other, whether it's plant-based or not, or botanicals. So some of those nutrients are going to be of benefit. Like when people say to me, oh, I used this and it said it had this and it did help with the inflammation. Well, okay, fantastic. Just like use hydrocortisone, that brings down the inflammation as well, right? So it just kind of...
So does ice.
Right. Right. But at the end of the day, I tell patients as well is that I do same thing in aesthetics, just like I do a hair analysis, I do a skin analysis, right? With the 3D imaging. And I show patients not only underlying photo damage and not only elasticity, but also wrinkles and their porosity, as well as the porphyrin, bacteria content and all that. And yes, we tell them to get chemical peels and exfoliations and other skincare regimen. So these are the things that you over time are able to document and show the results if you have the proper imaging techniques. And that's what I tell the patients, and I have them see it. And I know people will say, oh, but that's an extra cost or whatever. Yeah, but you know what? I don't charge my patients for those analysis because at the end of the day, I need them to walk out of the office content.
Exactly. We feel the same way about our in-body. We don't charge our patients for our in-body because I need them to see their body composition so they stay vested in what the goals are. And when I'm harping on them to freaking increase their protein and, drink their amino acids, they're like, okay, Lexi said, because I lost muscle, I got to do this, so no, that's great. That's super good. All right. I think I've got most of my questions kind of answered. I'm probably going to be like, wait, what did she say? I'll go back and listen to the audio, but what is your favorite topical exosome product? Do you have one favorite? Or is that like a loaded question?
No, the funny part is I was going to say my go-to is Chimera.
Okay. So, but like Chimera has a couple different products, right? Like, is there a specific one in that family?
Okay. So the thing is that, and number one, when you say topical, are you talking about for home use or using for like in office?
Ooh. The in-office one. And the reason I'm asking is because I have tons of practitioners who listen. And so it's kind of like if I were a new practitioner listening in, I'd be like, okay, if I'm microneedling and I want to put something good on the skin, what would be that product?
So this is the thing. So Chimera has the 3 different products, which has a different content in it, of course. And the Vive, which is the one that is also used because of the fact that it has the amino acids and proteins along with the actual exosomes, whereas the Luxeer is the pure exosomes. So it just kind of depends on, how much inflammation the patient has, what kind of treatment you're doing and all of that. If you're doing the microneedling and you apply the Vive on top, it also has trehalose, which actually is also an anti-inflammatory. So this this is the reason it has other ingredients mixed with the exosomes as opposed to the pure exosomes. So that's going to be the differentiator.
Okay. Perfect. No, that's awesome.
I love Luxier.
Okay.
That is my favorite go-to.
Okay. Luxier.
Practical, but everybody like says, oh, well, I'll use the Vive and I'll use Luxier. And I love the KISS principle. So for me, you know what? It's just simple. I just do Luxier. But for the simple person who wants to start slowly, easily, and also from a cost perspective for themselves and the patient, then they can start with the Vive.
Okay, perfect. No, that's perfect. If someone like a practitioner were wanting to get, in contact with like a rep, do they just go to the website? Is there like a provider page or like a contact us?
Yes, there is the website, but also Eric is the national sales manager for Chimera, and he basically can walk them through anything. And also because if any questions arise, then also Eric reaches out to me, especially when it comes from a practitioner, from a medical clinical standpoint.
Like a peer-to-peer. Yeah.
Right, exactly. Just because of the fact that sometimes if they have any questions or whatever, and because the reps can only say so much or do so much as well.
Sure. So, absolutely.
Yeah. And then also at the same time, if, like I said, peers always reach out to me anyways, whether it's through social media or through Instagram.
Yeah, I was like, I've DM'd you like millions of times. I'm like, Azza, help me. No, it's great. It's awesome. You're fantastic. Okay, so where can people find you? And I'll tag all your socials in the podcast notes. So your Instagram is at
Azza MD Beauty. So it's AZZA MD BEAUTY. And also my website is azzamdbeauty.com. Okay. So that is my personal website. But then I'm also located in Boca Raton, Florida, Newport Beach, California, Santa Monica, California, Chicago, which is in Morton Grove.
Okay. All right. So I know we have lots of patients who listen. So when you ask me, is there a practice you recommend? Okay, well, there's 4. I just gave you them. So Azza and her team are awesome. I just thank you so much, Azza, for letting me pick your brain on there. Where's the next? I know you speak all the time. You're like Carmen Sandiego, always on the go. Where is the next conference you'll be speaking at?
So I am going to be in Slovenia in a week because I'm going to be speaking at the International Laser Conference and also on the Photona lasers. So that is a big international conference once a year. And then after I get back, I actually will be at Cell Surgical. And then after Cell Surgical, I will be at SSRP. And then after SSRP, I'll be at the Aesthetic Show.
There you go. Are you doing anything in December at A4M by chance? The longevity?
In December at A4M.
I was hoping I was catching you there because I
also
will be watching
Aesthetics in November in Miami.
Okay. All right. I don't think I have that one signed up for yet.
And also, which I still haven't committed to yet, but the Pan-Asian Pacific in Bangkok in December as well.
Wonderful. She's always on the go. She's an amazing educator. She's such a great person, amazing provider. We're so lucky to have her as a guest on the podcast.
So
thank you so much. Thank you so much.
Thank you. And I am looking forward to seeing you. Are you going to be at SSRP?
So I will not be at SSRP only because my twins, they qualified for Youth Nationals Olympic weightlifting.
Wonderful.
And last year my son broke an American record and they qualified for the Pan Am team. So I can't miss that, right? My babies are still little.
God.
So
and they're so adorable. I just love all your family posts.
Thank you so much. Thank you so much. So I told the SSRP team, like, I'm so sad. This is like the first PWC in like 4 years I can't go to. And so they're like, no, we get it. We totally get it. So I'll be watching it virtually.